There's a lot of mixed information available regarding air travel and lymphedema. As holiday travel ramps up, I want to clear up some of this misinformation. First, it's important to mention that air travel usually occurs at altitudes above 10,000 feet. And while cabins are usually pressurized somewhere between 5,000 and 7,000 feet, most of us are used to living between sea level and maybe 5,000 feet. So for most healthy people, our bodies are able to adapt to these changes in altitude. However, if a patient has a known circulatory or lymphatic issue, even these small changes can affect our fluid circulation and absorption, as well as our skin tissue. Add to this long periods of immobility and dehydration with long-haul flying, and that can further worsen the issue. Patients with a known lymphedema may be at a higher risk for worsening of their lymphedema than patients who do not already have a known lymphedema. And I say it this way because I believe that there are a number of patients with latent lymphedema who are unaware of their status and could possibly be more affected by air travel than others. So I believe it's important to always wear compression garments if you have a known lymphedema or are at a significant risk for lymphedema. Make sure you stay hydrated and try to move throughout the duration of the flight in order to improve muscle pump action of our blood and lymphatic systems. Now let's look at some of the research. First, I'm going to start with a small study of 72 breast cancer patient survivors. In this study, all of the women were dragon boat racers, and it's important to mention this because it shows that these women were in excellent physical shape. They were performing significant amounts of exercise on a regular basis. So fluid was measured in both arms, the affected and unaffected, 2 weeks prior to a flight and within 6 weeks after the flight with bioimpedance. Flights were both long and short haul, and air travel did not seem to cause significant change in bioimpedance ratios in the at-risk arm for the majority of these breast cancer survivors who participated in dragon boat racing. More recently, a systematic review looked at 55 studies in women with breast cancer and showed that less than 14.5% of women developed lymphedema after air travel. But again, note that number is not zero. Now I want to review a small study I found from 2006, looking at the lower extremities. 20 patients were assessed, 10 with risk factors for a blood clot and 10 without, before and after long-haul flights of greater than 9 hours. Results showed increased lower leg volume in all participants, as well as skin thickness changes that lasted greater than 1 day after arrival. Greatest differences were seen in the calf area, but also up through the thighs. I think this study conclusion is important to read exactly. These data give good support to the argument that travelers should wear individual adjusted pressure stockings during long-haul flights. This seems to be an important outcome of the present study. Wear stockings during the flight, and especially after the flight, because as this study has shown by the tissue thickness measurements, outward filtration continues to rise after long-distance flights. Since the outward filtration diminishes the intravascular blood volume, such a vascular volume reduction might propagate venostasis and a thromboembolic event. This is especially likely for those subjects who have additional risk factors for clot formation. An increased risk of DVT is evident in long-haul travelers if additional risk factors are present. These pathophysiological mechanisms are supported by field studies showing that below-knee stockings are beneficial in reducing the incidence of DVT and leg edema formation after long-haul flights. I hope this information will better prepare you for any upcoming air travel. My name is Lisa Berman Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart.